Hello, everyone. Good morning, good afternoon, good evening, wherever you're tuning in from. I think most of us are in California, so it's morning for us. So excited to be here for our AARP series, Healthy Living series with Nurse Alice. And we will be today's topic of discussion. If you didn't know, we've been doing the series. I think this is our third or fourth one. And today we're going to be talking about protecting your senses as you age. Now, I'm knocking on the door of 50. But listen, I have my readers on, so no shame in game. This is not a prop. I actually use these. And we're going to be talking about our senses as we age because it can be pretty scary when your hearing or your vision isn't working like how it used to. And especially in this fast moving world, it can be of major concern. So I'm delighted that I'm able to be with you to present. And just a disclaimer, I am a family nurse practitioner. I'll talk a little bit about my experience. Today's presentation is for information only. Although I am a provider, not your provider, but I'm hopeful that this information will maybe answer some questions you have, spark some other questions, so you can have a dialogue with your healthcare provider about what's specifically going on with you. So this is for educational purposes only. I've been in healthcare for 26 years now. I am a family nurse practitioner. I work in emergency room currently, but I've been in family medicine and cardiovascular health for a very long time. My mantra is I like to talk to people before they become my patients. And I've been a long time AARP ambassador. I've done several campaigns and initiatives with them. And I'm also the founder of AskNurseAlice.com. It's a online platform that has health information, the health library, similar medical grade, symptom checker, and things of those sorts. You can check that out. And then as well, the host of the Ask Nurse Alice podcast, right? Health and wellness takes center stage because there's just so much going on in the world today. We have healthcare providers and they're an important part of your team. Always connect with them, but it's helpful when we can educate ourselves on different topics, especially as they relate to us. That way, when we go and talk to our healthcare providers, we can really make it a very fruitful visit and make sure we get our questions, our concerns, and our fears addressed.
Hey,
So
Nurse Alice, yeah, your audio is a little choppy.
Yeah.
So
uh,
let's.
let me come off let's just let's see here. What
Oh, that's better.
is, is it
Whatever you
better?
did. Yes,
Did that make it better? Okay,
that's perfect.
perfect. Okay, good. So, learning objectives. We're going to go over what's normal, what's not normal, and what are early changes and what are kind of expected changes with aging and what aren't. We'll explore some of the latest tools and screenings and strategies to help you with your sight and hearing. So, for example, we go for our Medicare or wellness visit and we have our physical and we say, oh, okay, well, that's what they did. So that must be it. But sometimes there are screening opportunities that we need to ask for to ensure that we get to make sure you stay on top of not only your overall health, but your hearing and your vision, especially. And we're going to talk about how we can boost our communication and stay independent if you are someone who's experiencing changes with these very important senses. So, quick poll. You don't have to say if you don't want to, but if you don't mind sharing, what concerns you the most? Is it vision? Changes in your vision, changes in your hearing, maybe it's a little bit of both, or you're like, you know what, I'm good. I don't have any concerns right now. And I like to ask this question because it kind of sets the tone in the room. So I know exactly kind of who I'm speaking to, so I can emphasize a point if I need to here based on what's in the chat box. And I have to be honest, as someone, I haven't experienced any changes in my hearing, but I've experienced some changes in my vision. And so that can be a little bit scary, especially when you don't know what's normal, what's not normal. Sometimes our mind goes to the worst, right? Or sometimes it's so subtle. Should I say something to my provider or not? Maybe it'll go away. But yeah, let me know what it is that is concerning. So both. I hear a lot of both. Yeah. And understandably so, because our senses are how we connect to the world. What we see, obviously, for a variety of reasons, safety, for engagement. We got to watch our favorite shows, right? Want to hear our favorite shows. We want to hear sounds that could be important to our safety. Hear our grandkids or hear that, whatever's on the stove whistling or hear a fire alarm. All of these things are very important, not just for our personal pleasure, but also for our safety and to function and to operate in life. Okay, so
And I see a couple of things too. They mentioned hearing loss, ringing in ears, and then someone mentioned
ah,
just having cataract surgery as well. So they
okay.
said neither, but they did just have surgery.
Okay, very good. And we'll get into some cataracts and also tinnitus, kind of that ringing in the ear. And there's some emerging technologies for that. So we're in the right place, y'all. We're going to be talking about this. But I will say, our senses matter for a variety of reasons. Again, it's how we connect to our world. It's the lifeline. It's our lifeline. Now, are there tools that can help us adjust or work around those things? Absolutely. But I think what's most important is that we understand what's normal, what's not normal. So you know then when you need to seek care or when you know what, it's time for a tool or something. I need to make sure I have something to help me with this because having a deficit in one of these areas could be potentially unsafe or harmful. All righty. So, but again, safety, driving's a big one. Uh, listen, and I know and I'll say this, electric cars are on the horizon, and that was largely due to help promote safety and independence, but we still have to be attentive. Connecting with our loved ones is so important. And then protecting our mental health because having some deficits in either of these two senses, especially, can contribute to a decline in some of our cognitive function. And then also our mental health. It can lead to some depression. So, and some people might say, oh, I'm fine. I just like for me, like I did go to my ophthalmologist, but she said at the time I didn't need prescriptions to just get my readers from over the counter. So I did. But, you know, identifying when we're having changes in our hearing or our vision is very important because there's indeed a hidden connection in that there can be the sensory decline can increase risks for certain conditions. Now the stats that you see in front of you are for when people have a decline in both hearing and vision. It almost seems like when one's deteriorating a little bit, another one kind of strengthens to a certain degree. The body does compensate, but you still need to be mindful of it because dual sensory impairment can lead to increased fall risks. You don't necessarily see far enough ahead to see that step is a lot bigger than what I thought it was. Sometimes you don't hear sounds that can make us aware of our surroundings and safety. It increases, like I said, 2 times the risk of depression, faster cognitive decline, and again, I don't have, guess I have it here, higher depression with dual sensory loss. So what's normal aging versus the warning sign? I think it's very important to know the differences because some changes are expected, like needing reading glasses or having a slower adjustment to darkness. I don't know about any of you guys, but sometimes when I adjust like dark, I gotta kind of move my eyes a little bit, get some focus here, right? Or there might be some mild hearing changes in noisy places, but uh, those are some of the normal expected changes over time. For some, it happens earlier than others, but it can be normal based on our anatomy and physiology. But the warning signs, the red flags, these are things that we really need to be aware of. Is when there's a sudden and acute vision or hearing loss. You're seeing double vision. You didn't, this is new. Flashing lights, blind spots, or persistent ringing in the ears. Now, I know someone mentioned tinnitus, and we'll talk about that. But whenever there's something new, like, oh, if this wasn't like this, or it's significantly worse than it was before, these are the things that should be red flags where it prompts you to seek immediate care from your healthcare provider.
Hey, Nurse
Yes,
Alice, one more time
yes,
too with the sound.
no.
I
Is
don't know.
everyone okay? Should I try taking them out here? Let's see. Now you probably can't hear me. Can you hear me?
We can hear you. Yeah, that's better, Nurse Alice. That's much better.
Is this better? Okay.
Yep. Yep.
So, okay, perfect. So let's talk about first, we're going to focus on our vision, understanding what's happening to your eyes as you age. And just curious in the chat box, does anyone feel like, you know what, I've heard this before, my healthcare provider has talked to me. Just kind of curious, have you had these conversations with your healthcare provider for them to guide you through, kind of what's expected, not expected? Curious to know. As healthcare providers, we should be having these conversations with you. Um, Sometimes we might not prompt it if you don't alert us that there's some changes. Okay. Now, okay, not yet, not yet. Okay. Well, and perhaps there hasn't, I don't know if there's not been a concern or maybe you've not brought anything up, but ideally we should be asking the questions like, so how are things going? Any changes in your vision, your hearing, your taste? These are some of the questions that should come up because ideally, I shouldn't wait for you to mention that you're having changes, but kind of ask you at key milestones where most people start to have changes if you're experiencing any of these things. So we're going to talk about some natural vision changes so that occur with aging. And the first one is called presbyopia. I know this is it's not a common language that we would use in, the living room talking to your family. But this is when you start to have some difficulty with being able to focus on objects that are near to you. So this starts to happen generally in the early 40s. That's when it becomes noticeable and definitely will worsen up until age 65. And this is the most common reason why people start to need reading glasses after the age of 40, which is hence my readers. So that's a normal part of aging. Also some pupil changes. Now the pupils are the dark spots in our eyes. And so as we age, our pupils naturally get smaller. And when they get smaller, that means less light goes in. And so with that, it can sometimes make it a little more difficult to see in darker environments. We also have some the lenses in our eyes change also. They become thicker and less flexible. And then also our nervous system, um, there's just as minor, but a slight a slow the message from our brain to our eyes about, oh, you're in a darker environment, time to dilate the eyes so more light comes in. That's a little bit slower too. So these are some things that can happen with our pupils that can make it a little more difficult for us to navigate, especially in darker environments. And then dry eyes. Is there anyone on here who doesn't deal with dry eyes? Because I'm going to say dry eye starts to begin about 30. And chronic dry eyes can actually contribute and expedite some of these vision changes. So if you're not already usually someone by the age of 40, usually, and I'm going to show you I carry them in my purse. Refresh. Now I use Refresh. You don't have to use Refresh, but lubricating our eyes are important also. It helps with vision and really helps to lubricate our eyes, makes it less painful. You can actually really get tired. I don't know if anyone's their eyes are dry, start rubbing them, you feel like you're more tired, more challenging to focus, but dry eyes can contribute to that as well. So these are some natural changes, things that are going to happen whether we like them or not, just because that's how our body's going to change over time. But there are some other things that can happen to the eye, which are actually diseases that we should know more about. I'm going to talk about four of the major, most common ones that we see and talk about how detection and treatment can preserve your sight. Because with these eye conditions that I'm going to talk about here, if they're left undetected, untreated, they can expedite vision loss, vision impairment, and can sometimes lead to blindness. So someone said, had dry eyes for years, but it's improved now. Okay. Didn't have dry eyes till I had cataract surgery. Okay. Um, and I don't for the individual that had cataract surgery, I don't know how long ago you had your surgery, but definitely talk to your provider about keeping your eyes lubricated because I'll just say keeping your eyes lubricated. It allows for the lids to open and close and to slide over your eyes a lot easier. That lubrication helps to if there's like dust or something that gets in your eye, helps to kind of capture it and remove it. So it actually is the lubricant is protective to our eyes. So we're going to talk about cataracts here. And it sounds like someone on here had cataract surgery just recently. I think okay. I use Refresh. So we are not endorsing Refresh, but a version of a lubricant. Talk to your healthcare provider about what works best for you. Um, so cataracts. And so here's a picture of a normal eye and then a clouded lens here. So cataracts occurs when the clear lens of your eye becomes cloudy, and that's a buildup of proteins in the eye that start to clump together. And it can give you the impression that you're looking through like a fogged up window. Your vision can become blurry, colors may appear to fade, and the glare like from headlights or sunlights can become even more bothersome. But here's a visual depiction you can see here in the normal eye versus the clouded lens. And again, these are proteins that have kind of clumped up in that sense. So some of the risk factors for this are diabetes, smoking, excessive sun exposure, steroid use, family history,
So these are things that you should be aware of. Now, is some of this age related? Well, the protein buildup here can sometimes be age related. So and there's also believed to be, again, a genetic component, which is why we say, there's family history can put you at increased risk from this. But when you knowing what this is, right? So if you're someone who's experienced those symptoms I talked about, maybe you have some of these risk factors here and you haven't gotten your eyes checked out, talk to a healthcare provider, your primary care provider, and they then should probably refer you to an ophthalmologist, not the optometrist. Optometrist helps you with the prescription of your glasses and, those type of things with the glasses, and any type of vision devices type of things. The ophthalmologist is a doctor who specializes in diseases of the eye. Okay, let's see, we're getting some chat box here. I took the AARP safe driving course. That book. Oh, yep, checking your eyes. I love it. So look at this, Antoine. They're talking about the AARP safe driving course.
Yes,
Good.
I know. I saw that. Yeah.
Your eyes and hearing are so important. Now I know technology, again, those electric cars are on the horizon. They're supposed to help with that. But in the interim, even still, having your eyes checked out is extremely important. Now, cataract surgery is one of the most common, or excuse me, so with cataracts, there's surgery that can be done, and it's one of the most common, and it usually is an effective procedure. So this is one of the four conditions that I wanted to talk about. I think, again, it's the most common one here. Glaucoma, the silent thief of sight. So glaucoma is a condition that damages the optic nerve, and this usually is because of increased eye pressure. The danger is that it steals your peripheral vision. So not that central vision, like right in front of you, but kind of I don't know if you had a doctor says, tell me when you can see my fingers coming into sight, that peripheral exam, when they're taking your fingers. So you start to lose your peripheral vision, which still is, even though you're like, well, as long as I can see in front of me, that's okay. But you need to be able to see the periphery for safety reasons, right? You want to see that car that's trying to speed through that yellow light, right? Before you move forward. Now, because it's your peripheral vision, though, because it's the outers, sometimes this isn't detected right away. It's usually not a problem until it's really a problem. And so most people don't notice it until it's pretty significant. Now, we have some risk factors here. Let's move this. So risk factors include family history, diabetes, high blood pressures, and certain ethnicities are at higher risk. But the key here is checking eye pressure regularly. So if I may ask, when's the last time someone had their eye pressure checked? And I'll tell you what it is. Usually the doctor put some numbing drops in your eyes, and then they took it looks like almost like a pen, and they actually tap your eye to check the pressure. Does anyone recall? Okay, 2 years ago, last year. Okay, right. Now, after a certain age, I would say, well, whichever comes first. If you start to have vision issues, or at least I would say by the age of 50, you should be having your eye pressure checked routinely with your eye exam, because we don't want to wait till there's a problem to identify there's a problem, because commonly what I will see is the eye pressure starts to build up, and then that will prompt me to ask the individual, well, are you having any vision changes? And usually they'll say no, but then when we do there's a battery of eye exams, but when we do the peripheral exam, it's like they don't see the fingers coming into cue. Or nowadays they have like a little machine, you sit your head in there, and then they flash lights on a screen and you push a button every time you see the light. That might be, that's kind of the newer version of the peripheral exam. But but knowing it's called a peripheral exam, you want to ask your provider, like, hey, when's the last time I had this done? Everyone knows the letter and the number chart, the Snellen chart, but these other exams are still very important to check for this condition, because that Snellen chart that most people see, it's like the large letters. It's like, read the line, right? What's the lowest line you can read? That eye exam cannot tell you if you have glaucoma. So the only way I'm going to know or suspect glaucoma is if you tell me that there's a problem, or I do a peripheral exam and we get ahead of it because there's been some decrease in your periphery vision. So it's important to know that these are some of the most common ones. So when you go to your next physical, or maybe you go see maybe you already see an eye doctor, ask like, hey, have we checked for this? Have we checked for that? But again, unless you say something or we do these exams, we're not going to know that there are any issues brewing. Also, macular degeneration. This is also known as central vision loss. So this is where you really see issues looking in the central part of your eye. This disease affects the macula, the part of the retina that gives you that sharp central vision needed for reading, for driving, and for recognizing faces. So some of the risk factors here include age, most commonly after the age of 60. Now, that doesn't mean it can't happen sooner, especially if you have family history. So this is why knowing your family history is important. And then also, if you are the senior in the family, making sure that your children and your grandchildren know your history as well. Because I didn't know for a long time that my grandma had glaucoma. So now, and I'm also being vulnerable and sharing because I feel like we learn through other people's stories, but I don't have glaucoma, but I'm considered glaucoma suspect based on my exam. So I go every 6 months for different eye exams to make sure that we're staying ahead of it. I'm not at a point where I need medication or surgery, but we're watching it. So the minute something changes and I cross a certain line, then we'll start to implement treatment. And that's why knowing your family history is so important. Because I was having some changes. And then when I learned that my grandma had glaucoma, I was like, oh, okay. So we're a lot more diligent because we know there's some genetic components to this. But okay, risk factor. Sorry, I got sidetracked with my story. But advanced age, obesity, and poor diet, and genetics definitely plays a role in this. So early detection and lifestyle changes can slow the progression of this. And there are new treatments that can extend vision for many patients. Now, the treatment here, and I won't get too deep in this because I'm not an ophthalmologist, but there is a wet versus dry version of this. And so for the dry version, there's no cure. It's just trying to preserve your vision as much as possible. And then for the wet version of this, there are some eye injections and other medications that can be given. But this one is responsible for the central vision. Remember, glaucoma is the peripheral, and the macular degeneration is that central one. So definitely want to stay on top of your screenings, ask questions, and assess your risk factors for this. And it's okay to, if your provider doesn't ask you, it's okay to say, you know what, I'm really concerned about my vision. Even if you've had just subtle things, even if they're age-related things, still put it out there for your provider to take all those pieces of information and paint a bigger clinical picture because they are the specialists. Now, the diabetic eye disease, this is diabetic retinopathy. Now, this one is pretty common, and it happens especially because we know that there's such an increase of number of people who are diabetic and who are pre-diabetic. And I know this is not a diabetes presentation, but for people, once they're diagnosed as having diabetes, they've generally been living in a pre-diabetic state for several years already. So even in that pre-diabetic stage, there are some changes that can happen to the eye. And this is the leading cause of blindness in working age adults. But the good news is here, it's largely preventable with good blood sugar control. So what we eat, our lifestyle, those type of things can help us prevent or minimize this condition. And what's happening here is you have high blood sugar levels. Like we know, we typically see someone who has diabetic, they do the blood sugar check and they're managing their blood sugar, but we don't necessarily always, we think about the eyes, right? What happens is when you have unmanaged elevated blood sugars for an extended period of time, it causes inflammation in your blood vessels. And for the larger blood vessels, they might be more tolerable of it because you have a large blood vessel, a little inflammation. You still got a nice lumen for blood to flow through there. But if you think about the tiny, tiny, tiny blood vessels in your eyes, there's not that same reserve. And an elevated blood sugar can actually kind of clog, if you will, I guess visually, I'll just explain it this way, it can kind of clog this very tiny blood vessels that feed your eye and your lens and the important structures in your eye. And that's what can contribute to vision complications. So one of the best things for this is to manage your blood sugar levels, diet, exercise, getting regular eye exams. And if you're diabetic or pre-diabetic and you're having vision changes, even more reason to be vigilant about talking to your provider about what's going on with your eyes here. All right. Vision warning signs. So you want to act fast. Again, we talked about kind of what's normal, what's not normal. And we talked about these 4 conditions. But one of the key things I want to say here is whenever you have any sudden vision changes, even if there's partial, this requires immediate care. And I know you might feel like, oh my gosh, Alice, I mean, not necessarily that you're calling 911, being transported by an ambulance, unless you just lose your vision completely, then absolutely yes. But if you're like, okay, something's happened, I got to get to the doctor right away. And if it's not your primary doctor, go to urgent care, or maybe have someone take you to the emergency room, because the vessels in the eye are so small. The blood flow to the eyes are so small that time, kind of when we think of brain and our like heart, or excuse me, stroke with our brain and heart attack with our hearts, our eyes are very important organs. And if we're having some vision changes to our eyes, sometimes that can mean, the blood vessels are compromised, or maybe the lens has detached. Something that usually when something like that happens, if it's happened acutely, it's oftentimes something that may require immediate surgery or some type of procedure to relieve pressure in your eyes, or any of those type of things. So don't wait. If you have some sudden changes, go right away. Flashes or floaters, especially if they're new or sudden, are a lot worse. This can signal retinal detachment, and that requires immediate surgery to preserve your vision. Immediate surgery. Do not wait till, oh, it's Friday, I'm going to go on Monday. The vision changes may become permanent by that point. And then any type of severe eye pain. Now, if I've had something, I've had dirt fly in my eye. We've all had that, right? We're rubbing our eyes. But those times where you feel like, gosh, there's constantly something in my eye. I can't get it out. I flushed it. I don't see anything. You're in the mirror. You're doing one of these numbers, right? And you can't see anything. You need to go to the emergency room, because they have special drops that they can put in your eyes, and fluorescent lights they can put. Sometimes you can have corneal cuts in your eyes that aren't visible to the naked eye, but you need to get to those specialized tools, and you need to act fast, because it can cause permanent impairment of your vision.
Hey, Nurse Alice, I don't know if you were gonna, or if you hit on this and maybe go back, but someone did put in the chat about ocular strokes. They wanted to, if you're gonna
Oh,
talk a little bit more about that or how they occur. I don't know if it's further in the presentation or not.
well, I wasn't going to talk about ocular strokes, but I mean, that's actually something that's very important, because when we think about a stroke, right, a blood clot in our brain, or heart attack, blood clot in our heart that's impairing blood flow, it absolutely can happen to the eyes. It absolutely can happen to the eyes. Is it more common? Not necessarily, unless it's more related to like something of more of a diabetic neuropathy, like an unmanaged blood sugar type of level where your inflammation is extremely um, I have, I mean, I could look at a picture of the eyeball here. Yeah. So see this eye, look how tiny. We don't need eyeball tiny. This is not at all. So just kind of, so if we were to, I'll say this, high blood pressure, chronic high blood pressure can also cause, and which generally at the intervals as a heart attack or stroke? No, it doesn't. But I can't say, if I don't want to, I can't roll the dice and say who it's going to happen to and who it's not. So if you're in that situation where you have high blood pressure or diabetes or some type of inflammatory condition, it can cause things like that. Thank you for asking that. See, this is why we're doing this, to kind of give you some dialogue and information so you can feel more empowered to go back to your healthcare provider and talk about these things. Okay. Oh, here we go. So now let's go here. So protecting your vision. Oh, your vision is so, so precious. Listen, if money could buy health, right? And we could say, oh, well, it could buy medications, it could buy healthier food, it can get a gym membership, but you got to do it, right? You got to do it. And I'll say this, sickness is the great equalizer. doesn't matter if you have money, you don't have money. And especially when it comes to your eyes. Now we think of it this way. Some people are like, okay, I can have a kidney transplant. I can have a heart transplant. I can have a lung transplant. I've not seen an eye transplant. I just haven't. Cornea transplant, yes, but not a whole eye transplant. So, and I don't know, maybe science will get us there one day, but your eyes have such an important role. I know the heart and the brain have an important role, but your eyes literally are what keep you connected to the world. You can see. Now, I can only imagine people who have significant vision impairment or blindness, how challenging it is to maneuver through the world, as far as personal satisfaction, as far as safety, just being able to care for yourself. So we want to be as independent as possible. And part of that requires you to protect your vision. So you'll want to get annual eye exams. So I'll say this. When you say I need an annual eye exam, it needs to be very clear with your provider. It is more than just reading the Snellen chart, okay? That can include dilating your eyes so they can get a closer look at all of the features in your eyes. It also includes doing that periphery exam to check your peripheral. So the Snellen helps check with that central vision. We need to check our central vision. We need to check our peripheral vision, and the provider needs to take a look at the blood vessels and the things back in your eyes. Even and some people, and depending on how your vision's doing, they may actually even do an MRI where they can actually look at the very small vessels and structures of your eye. Now you don't need to do our MRI annually, but an annual eye exam where they do dilate and check for peripheral vision. UV protection, wearing sunglasses to protect your eyes, because all that UV damage we talk about skin cancer, but it can impact your eyes as well. Also using proper lighting. So we talked about conditions where, because we age, our pupils are getting smaller, making it more difficult for us to see in dimmer environments. We might find ourselves in that situation. So turn on the lights, make it, this is where you can augment your environment so you can optimize your vision and be as safe as possible. And no need to strain your eyes unnecessarily. We did all that when we were younger. Now we don't have that as much reserves, and we don't need to stress our bodies that way. Healthy diet, nutrition, all of those things are very important. And everyone asks me like, oh, well, what can I eat for my vision? Vitamin A, a lot of your red foods, carrots, sweet potatoes, all those usually the red and orange vegetables are good. But you have omega-3 rich foods, antioxidants, those things are kind of good, also good, and they help protect against macular degeneration. Smoking is something you'll want to avoid and minimize and actually just stop doing, if all possible, please, because smoking causes vasoconstriction of your blood vessels. That's why, we think about high blood pressure, but think of what happens in your eyes. And it also causes inflammation. So if I have a tiny vessel in my eye and that becomes more narrow and I complicate it with inflammation, that's going to be not good for my eyes over the long run. And then staying active. Regular exercise can improve blood flow, like improves blood flow to the brain and to the heart, improves blood flow to the eyes as well, and may reduce or offset your any type of glaucoma, and definitely minimize your risk of diabetic retinopathy, because that's going to help you manage your regular blood sugar. So here's the eye exam that we're most commonly used to. This is the Snellen chart. Just be aware that when you say you have an eye exam, this itself is not a complete eye exam. This is a routine. This is a routine vision test, and it's easy to do. So that's why it's done. It's easier to do, and it can usually give us an idea if you're having any visual acuity, or you're having any difficulty seeing from afar. So we kind of hear that 20/20, right? Oh my, well, I'm gonna tell you now, my vision is not 20/20 right now. My vision is 2030. So, wait, 2030? Yes, 2030. So I see at 20 feet what most people see at 30 feet. Okay. Now I'm going to throw out another number there. 20/15. 20/15. That would mean that I can see at 20 feet, or excuse me, I can see at 15 feet what most people see at 20 feet. So I know that gets a little confusing. But just know, so if you're ever interested in what those numbers mean, the top number is the number of feet, what you see. So let's take the 2020 again. At 20 feet, and is what I see, and at the bottom number is what most people with normal vision see. So 2020, that's, I see at 20 feet what most people see at 20 feet. If it's 20, 20, what I say, 2015, what did I say, 2015? Top number is what you see, the bottom number is what most people see at regular. So look,
I think
if
you
I
said 1520 as an example.
15,
Like
20,
you
so
saw, yeah.
oh, so I could see at 15 feet what most people see at 20 feet. Now, I saw that when I was younger. I am not there, and I don't really see that. So just so you know. Um, anyway, but this itself is not a complete eye exam. This is just a portion of it. Okay, just wanted to say that. You need, so an essential, more comprehensive eye exam would be that Snellen chart that we just talked about. A comprehensive dilated eye exam where they can go back and see the structures and the features and the blood vessels in your eyes. And on this slide, I'm not going to read it all, but you'll get a copy. You can have a copy of this or watch the replay. Below, I put when the recommendation is. Recommended annually for adults over 60 every 1 to 2 years if you have risk factors. But if you've had vision changes before then you can have it done sooner. Checking for eye pressure, right? That's when they put the drops in, numb your eyes, and they take that kind of like pen-like device and tap your eye like 5 times, and they come up with a pressure. Sometimes that pressure will increase before you have any problems, and that's important to know. And then the visual field test, that's the peripheral exam. It's like, tell me when you see my fingers. Tell me when you see my fingers. Or sometimes you sit in a device and they flash lights and you're supposed to push, you're supposed to look ahead, and then whenever you see a light pop up somewhere on the screen, even the periphery, you push a button. So this is what you need, all of these things to have a real comprehensive exam. You can do this type of test. Generally, you have to go to an ophthalmologist to have a fully comprehensive exam like this. Your primary annual physical doesn't cover all of these things. So after a certain age, just based on what I said, it would behoove you to go ahead and ask for a referral to an ophthalmologist. Now, do you need to see an ophthalmologist every year? Well, not if you're staying ahead of screening, but you could. But your primary healthcare provider may not be able to help you with all of these exams. So here's a 2020 rule for screen time. Every 20 minutes, look at something 20 feet away for at least 20 seconds to kind of look at to kind of exercise, if you will, your vision. So every 20 minutes, look at something far away for 20 seconds. And I didn't put on here, but you can also look at something very close for 20 seconds. So you're checking your far distance and your near distance. So that's kind of exercise for the eyes. Now we're going to get into hearing. Gosh, we could talk about this all day, Antoine. I know. I care so much. I go into so much detail with y'all that I kind of, then I'm pressed for time, but it's because I love answering these questions and giving you the information that sometimes you don't necessarily always get if you're a primary healthcare provider. So hearing loss, gradual hearing loss, this is something that's normal. Usually it's gradual hearing loss in both ears, and it usually starts with high frequency sounds. Something else that happens when we age is processing delay. So your brain takes a little bit longer to interpret sounds, especially rapid speech or environments. So sometimes someone's talking so fast, you can't interpret everything they're saying because they're talking so fast. And it's really like a milli of a second, microsecond, but there's some delays with processing that as we age. And then tinnitus, that's the ringing, buzzing, or humming that becomes more noticeable with age. And I'll say this, there are some good news on the horizon. There are some devices that are coming out that propose to be able to minimize tinnitus. Just wanted to plant that out there. But here's some common causes for hearing loss. Noise exposure. So when you're working in loud environments or at concerts, and I know, and I'll say this, at a concert, you want to enjoy the music, but sometimes you need to put some earplugs in. You can still hear the music, but it just doesn't have to be so loud and blaring. So high volumes, and if you're working like in construction or around loud noise, it's okay to put some earplugs in to protect your ears. Repeated infections, otitis media, otitis externa, and anything like that. So if for example, if you're a swimmer and get a lot of water in your ear, also that could be a cause for this. And then certain medications, certain chemotherapies and diuretics. can cause this medication. High doses of Lasix or rapid administration of IV Lasix. A lot of people take that's a water medication, like a diuretic. That can contribute to temporary hearing loss as well. There are also chronic diseases, diabetes, heart disease, and other kidney problems can also affect ear circulation. Because if you have circulation issue for those, for the heart and the kidneys and other things, so you can likely also have that in your ear. And then earwax buildup. That's one of the most easily fixed ones. And I'm always happy when that is the problem, or that is the issue, because that one we can resolve fairly quickly. Now, are you missing any warning signs? Does anyone on here experience any of these things? Frequently asking what, or asking someone to repeat themselves during conversation. Maybe you've had to turn up the television or radio a little more over the past couple of weeks. Maybe you're missing important sounds, like, gosh, someone's at the door. I didn't even hear the doorbell ring, or you didn't hear an important sound. Or maybe you've been a little more isolated at gatherings because conversations are too difficult to hear. Now, if you've experienced any of those things, and the last one is kind of like you've isolated yourself because you don't want anyone to know that you're having problems hearing, these could be signs of hearing loss. So if you experienced any of these things, then this is also probably a good wake-up call to say, you know what, I need to get my hearing checked. When was the last time I had my hearing checked? We're going to go into what those tests look for. But before we get there, how do I protect my hearing? So listen, you need to have regular hearing screening starting at the age of 50, sooner if you've had other hearing issues, wearing those plugs in large environments, making sure, we're guilty of it. You all just saw me on there, putting things in our ear, these little earbud things. And actually, this is probably a good time for me to say it, I'm actually going to be moving away from these to the more back to the old school headsets. Those are better. Putting things in our ear for extended periods of times, we're going to expose ourselves to larger volumes. Having our ears cleaned professionally, getting your earwax removed. Be careful, Q-tips. I know they feel good when our ears itchy, but sometimes we can push stuff back in. And then managing stress, staying hydrated, blood pressure control. Also certain medications can be ototoxic. So if you're someone who takes regular medications, just look to say, I've been having some hearing issues. Let me look to see if many of my medications have side effects of being ototoxic. So that can impact your hearing. Let your doctor know if that is the case. And then again, cleaning your ears safely, letting a professional do it. Now, when it comes to how to help us with our hearing, we've talked about some things of how to protect ourselves. Also want folks to know, because I've met a lot of people who have hearing issues, but because they've not been able to afford prescription hearing aids, have gone without. Now, I think this has to be about maybe more than 8 years ago already, but there are now over-the-counter hearing aids that now they're available without a prescription, and they're for mild to moderate hearing loss, kind of like readers, right? You're like, oh, I just need a little something to help. So it's similar fashion, but it's to help with your hearing. So you might buy one and it's like, oh, let me play with it. It's okay. It's not a medical grade, but it's something that can kind of help you get through something while you're waiting to get your prescription hearing aids. But wanted you to know, if you didn't already, that there are over-the-counter prescription or over-the-counter hearing aids that you can buy that don't require a prescription. If you're someone who's been struggling a little bit, haven't gotten hearing aids, maybe you want to check something like that out. But also still talk to your healthcare provider that you got one. And if you got one and it really helped, definitely talk to your healthcare provider so they understand that, they might be able to provide some recommendations for as far as tweaking or setting putting the settings in them. So here are your hearing tests. How do I check my hearing? There's the pure tone odometry and the speech odometry. So the tone odometry is they usually put the headphones on you and they have you click the button when you're hearing the sound. This checks for different frequencies and pitches. So you should definitely have this done annually if you're over 60 and every 1 to 3 years, but you can have it sooner if you're having hearing issues. And then also with speech, this test assesses your ability to understand spoken words. So sometimes when people, it's like maybe you can hear, but you're having difficulty with certain sounds. So that can help with that's important for testing hearing as well. So it's often part of a comprehensive exam. So all of these things are, this is just information, but for you to now take a closer look at what you have going on in your worlds of with medications, your vision, your hearing, and realize that your vision is such a very important part of your whole body connection. It really impacts your overall wellness. It's how your overall health impacts your senses, as I mentioned, right? I mentioned about diabetes, I mentioned about high blood pressure, what that does to the vessels and circulation and how that can impact your vision or your eyes and the very important structures in your ear. Medications, we don't know this all the time, but sometimes the medications we take to help with one thing might cause some blurry vision. It might cause hearing loss or even if it's temporary hearing loss. If you're having some of those things, just look at your medications. At least you can better identify that, okay, this vision or this hearing issue is related to the medication and not these other things. But we've gone through the testing to rule out cataracts, glaucoma, diabetic neuropathy, all of those things. Let's still get all those off the plate first. And then it's like, oh, maybe it's my medicine, right? But as long as you want to know what the cause is of what those changes. And then kind of high blood pressure and heart disease, those kind of go along together. But when you're having different heart conditions that help impact circulation, which can impact your hearing and your vision as well. Okay. Technology and tools, we talked about this. So with vision aids, you can buy your readers over the counter, you can buy magnifiers. There are books that can now, everything electronic can make and even on your phone, you can make the font bigger. So we have technology and vision aids that can help us. I know some people like, what do you call the lenses, contact lenses. Now those are great for some people, but those can be challenging to use, especially as we get older and especially with infection control type of things. The less you have to touch your eye, the better. Hearing technology, now there's lots of Bluetooth enabled hearing aids that can help us. You can buy them over the counter. When now you get closed caption, you can when you're watching a movie, so you can see the words if you're having difficulties hearing, but it helps to still keep you connected. And then home modifications. Remember, if you have any hearing or vision deficits or impairments, that can increase your risk for falls. So wanting to make sure we have good lighting, maybe some motion censored lighting by stairs is helpful. Moving decluttered pathways, those area rugs, they look really nice, but sometimes they're trip and fall hazards. We want to prevent accidents from happening. So these are modifications to be done at your home to help keep you safe. Now it's important that you are your best advocate. So, obviously you're doing Healthy Living series with Nurse Alice and AARP because we care about your health and safety and want you to feel empowered with information. So when you go to your next doctor's visit or you see a nurse practitioner or physician assistant, that you bring your medication, your diary, any questions like, I was having, this vision changes started on such and such date. So you have accurate recollection because I'm going to do the best I can for you, but it's going to be based on the information you tell me. So become prepared to your appointments. Understanding your coverage for exams and devices and services. And I'll say this, sometimes hearing aids can be expensive and not all insurance companies cover them. Same with glasses, or some people, they have medical, but they don't have vision covered. So understand what your coverage is. Because myself as the provider, I take care of so many patients. I don't always know everyone's insurance plan. It's not to be mean. It's not that I don't care. I don't want you to have to pay a lot, but sometimes when you're with me, I'm focused on you and I may not have in my mind all what's specific for your insurance plan. So, charge it to the game, don't charge it to my heart. I want you to have the tools and resources you need. But if you come to me and say, my insurance doesn't cover this and that, and we know that in the conversation, automatically I can help you brainstorm with other things that we can get for you that were within your plan or within reach of us. And then also maybe it's like, let me write a authorization requesting this exception to your case. And then finding resources like this AARP community. It sounds like there's been some wonderful driving classes and other things that have helped you to stay informed, talk about assistive technology, and then a place where we can kind of share stories and experiences to know you are not in this alone. You're not the only one experiencing these type of things, and that Together we can brainstorm ideas, and perhaps you'll hear someone else's story or get inspired from them, so you can take better charge of your own situation and your story there. So here are your next steps. What's one action you'll take this week to protect your vision or hearing? Can you guys let me know in the chat box? Let me know if there was anything from today that you found helpful, that you're going to do, or that you're going to recommend to your peers or your families. Or it could be something like, you know what, I've already done everything else, but I'm going to make sure that my grandkids know that I have glaucoma, so they have it in their medical history. So, just to let me know what's one action you're going to take. And remember, small steps today lead to big improvements tomorrow in your quality of life. We many times we talk about living long lives, but it's also about living a long quality life, and protecting our vision and our hearing can definitely play a role in that. And look at this. The best time to plant a tree was 20 years ago. The second best time is now. So I'm encouraging you all to take your next step now. If you didn't do so 20 years ago, that's okay. So that concludes my presentations. I'll take any questions we have in this last few minutes, but I also want to take the time to invite you first to watch all of the replays that are on the website from our previous sessions. We talked about movement, we talked about blood pressure management, so many other things. And then also invite you to our next one. Now it says in person here, but we are going to record a webinar for you to watch the replay. And we're going to talk about ageless glow, that skin and hair tips. Aging doesn't mean fading, it's your time to glow. So we're going to learn about real and affordable care tips for your skin and hair, and avoid common mistakes, and build a routine that works for you. Even in your golden years, you can still have glowing skin and hair. So
Well,
any questions?
some of us, yeah.
Oh,
And
well, you're
regarding the
still
hair.
glowing, but your skin is glowing up here. Your
Thank you,
skin is glowing up there, Antoine.
thank you, Ursula.
And look at
Oh,
look at the healthy beard. See?
yeah, yeah,
There we
yes.
go.
There were a couple, and I know we're
Okay.
coming up to the end. We have a few minutes left, and for those who can stay on, please do, and we'll
Okay.
try to get to. But there was a
Sure.
question in the chat that I wanted to bring to your attention. It's
Oh, please.
where did
Okay.
it go? Time, I think, the information. Uh, Cleaning out earwax safely.
Mm.
That a person can do themselves.
Okay, so there are some over-the-counter drops that you can put into your ear. I think it's like one or two drops from each ear. You let it sit for a while, and then when you go and you shower, you just kind of put some warm water in there and kind of take your finger and do this jiggle thing, and it's supposed to loosen the wax. So the wax either kind of starts to just kind of washes out, it breaks it down so it washes out, and then loosens it from the canal so it can actually kind of come out as like you take your towel, or if you take a Q-tip to the external, it's really external. It's nothing where you have to go in. So that is something that you can do. Can you have a loved one help you? You could. I just want to caution, because I'm going to say it, but I also want to exercise caution. Because when people come in, especially in the emergency room, we'll have people come in and say, I all of a sudden I can't hear on the side of my ear. And then I look into their ear. Now I've seen a lot of things in ears. One lady was told that garlic is good for hearing, but it was really meant to eating garlic. But she took she smashed up some garlic and she stuck it in her ear. So I am trying to pull out the garlic. Please don't stick anything in your ears like that. But sometimes it's wax. And generally when there's like, if you think of the ear canal, generally if there's a little bit of wax and it's like covered up part of the hole, you can still hear. But some situations the the wax is built up and it actually covers the hole. So that sound that you would normally hear can't get to the eardrum and those the structures in our ears for sound to conduct. So that's when that kind of wax usually is pretty hard. We need to do some softening, and we need to irrigate it with salines. I wouldn't recommend doing that at home because you could damage your eardrum, but I wanted you to hear about it. So if you find yourself in that situation, you know that there is such a thing as ear irrigation, but it should be done by a healthcare professional.
Yep. Very, very good. And
Yes.
then there was another question about audiologists with the hearing tests.
Yes.
Are hearing tests standard, or does the quality of the audiologist matter?
Hearing tests, I would say this, for an annual wellness exam, your family provider should be able to do a standard hearing test where you hear the tones. Usually if that you didn't perform well on that test, or there are you've explained situations where you didn't hear important loud sounds in what's considerably unsafe situations, they will refer you to the audiologist. Well, they will do more in-depth tests. Now, obviously, I believe that is where you're going to get the higher quality testing, because they have all the tools, all of the fancy gizmos and gadgets to really do those things. So I would say that you should go if you're someone who's experiencing any hearing issues. Talk to your healthcare provider. Do the standard tests. If you're experiencing deficits in that, you should have at least one consultation with the audiologist to determine what's going on with your ears. So they can determine possibly how bad your hearing is. If you're at the level where you need hearing aids. So I think that's important to do. So don't just, I'm not going to say, well, again, they're over the counter hearing aids, so you can buy them at any time, just like you buy readers. But I would say this, don't just buy over the counter hearing aids and not see an audiologist, because you could be masking something that's going to continue to get worse if not identified and treated.
That's very, very good. Okay, I think you are at 11:02, couple minutes over. Um, there are a couple of questions in here too about if a hearing aid can cause a earache, and then UV sunglasses, and kind of what's the best to use. I think we'll try to we
Okay.
can put the answer maybe on the in the notes when we put this up, because this recording will be up on YouTube, on our YouTube page. So we'll take a look at that and see if we can include the response in the in the YouTube post.
Okay.
But
And
thank you. Oh, go ahead,
oh, I was going to say just really quickly, could my hearing aids be causing earache? The answer is yes. If they're not fitting properly or their setting is not correct, that could be causing an earache, because there's like an echo or things like that. So you want to double check fitting size and then also check the settings on it. And then also, yes, sunglasses. Now the UV 400, I'm not quite too sure with the settings, but having a set of sunglasses on is helpful. That tint limits the exposure of those ultraviolet rays into your eyes, which if we can protect some of that, just like we would do the better we can protect our eyes, like we do our skin, we can minimize any type of issues. There you go. Just
Yep.
want to throw that out there.
Perfect. And if you're like me, I have transitions, so
Oh
it takes a
yeah,
little
those
bit of
are
time for those to transition. And I get ragged by some folks from the younger generation, but I like them. So anyway, thank you, Nurse Alice, for this time. Thank you all for coming. As Nurse Alice mentioned, the next session is on the 28th of October. It is in person at the Crenshaw Family YMCA. You can go to our webpage on the screen to be able to register to attend. And then we have another session in December. And then thanks to Nurse Alice, we will be redoing this with different topics of discussion in 2026. So we'll have a whole schedule for the whole year, and then we'll let you know where those will be taking place, Zoom versus in person. But thank you again, everyone, for joining, and thank you so much, Nurse Alice, for not only your time but your concern and care for folks to, as you said, you want to see them before they become your patient, right? So
I, yep.
yeah,
I like to
all
talk
of
to
that.
people before they become my patients, which is sometimes
Yep.
why I go over time, because I just care about, I'm just loving on people.
Yes, you could
Especially in
caring
emergency
for
room.
people. All right. Thank you all. This concludes our session. Have a great rest of your day. And hopefully we'll see you at the next AARP event.
All right. Thanks, everyone. Have a great day.
Bye bye, everyone.